good time at the IPM? Yeah, excellent. So I'm Dr. Colin Crawford. I'm the owner of Crawford Chiropractic in Smithville here. I actually grew up from Smithville. Some of you may know my dad. He's Dr. James Crawford. He's a local veterinarian around here too. So I actually, believe it or not, I used to actually do plowing matches as a kid in grade school. So this is actually my first time at the IPM, and I'm actually very honored to be here. I look forward to looking around at everything when we get started. So as the name presents, it's about spinal health. So I want you to ask yourself the question, why is spinal health important? So before we get in, as we dive in, the anatomy of the spine here is very unique. We've got 24 individual vertebrae, and they're separated by a disc here that's going to act as your shock absorber, and we can see it creates a space for the nerve here. This is going to allow us to bend, twist, flex, and move without injuring this delicate nervous system we see here. Because your spinal cord is your basically superhuman highway. It's going to take your brain's messages out to the rest of the body and then back again. So I also want you to think is what happens if I put a little bit of pressure on these nerves here, because we're going to get into that later. The spine itself can be broken down to 3 individual segments here. As you can see from my degeneration poster, it kind of takes away what I was going to ask, but who can tell me what the 7 segments at the top are called? Cervical. So this region here is where our neck is, and a lot of these nerves are actually going to supply our hands, our arms, our shoulders, our mouth, our throat glands, our eyes. I actually had a patient the other day. He was trying to get the bag over his head. He was actually struggling, shaking as he was trying to get on there. I adjust one segment in the neck, without a doubt, easily just putting his arm around him. No problem whatsoever. The next area here we call the thoracic region, because there's 12 individual segments that are going to be supplying our organs here. This is going to be your liver, your heart, your lungs, your small intestine, and as we all know, we have ribs that surround that region, encasing those organs. So it kind of makes sense. The area is going to supply the organs and regions that we have around it. But unique to the thoracic region, who here has ever heard of scoliosis? Almost everybody, right? So scoliosis is actually unique because you can have something called functional scoliosis or structural scoliosis. So a lot of us think about scoliosis more in the structural sense of being bone, right? Somebody's got that curve, can't fix it. Not entirely true, because when we develop muscle imbalances, that actually creates a difference in our curve that we can actually correct. When we're kids though, it's important to screen for structural scoliosis, because that can have long-term detriment over time. So a simple way that you can do that is actually, I'll show you. We're going to have our knees straight, and then we're just going to bend forward parallel with the ground. Now, if I have a curve, the ribs are going to hump on the one side, and you're going to see that come up. That's going to screen you for a scoliosis. To evaluate the overall curve, though, that's when we need to get x-rays done, and that's going to give you an exact degree. This is very important, because if somebody is dealing with, say, like a 40 to 45 degree curve, they're younger, and they're in pain, can't move, their organs are getting affected, it's time for a surgical consultation. But before somebody gets to that point, it's important to try chiropractic care, because you can manage those curves beforehand. And then even if somebody, say, has like a 20 to 30 degree curve, once again, we can manage it through adjustments and chiropractic care. That leads us to the last portion here, the lumbar region. So these are going to be the last 5 segments. Once again, we can see what we would call like a scoliosis or curve. But more often, we actually see, what we can see here is that disc bulge as a result of the impact of gravity or improper lifting. Now, if that happens, what organs do we think are going to be involved now? Bowel, bladder, pelvic organs. A lot of those regions, actually, if anybody's noticed, say like the classic sciatica or numbness in the feet, all of that can be due to those areas in the spine here. So when we have an issue with our spine and it's not moving the way it should, so say we take a segment here and we put it out of place. Remember I was talking about how that's going to start pinching the nerve? Well, this segment here is not moving the way it should. So we actually call this a vertebral subluxation complex, a subluxation for short, or misalignment, or what I like to call nerve interference in the office here. This is not moving the way it should, and as a result, over time, it's actually going to start developing a lot of scar tissue in that area. And that scar tissue is going to compound and compound and compound until this area actually gets corrected overall. But the interesting fact about this, by a show of hands, if I take this little bit out of alignment here. Do you think you feel that? Put your hand up if you think you feel that. No.
Feel the pain.
You'll feel the pain, but the big thing is that that single segment could be a little fall as a kid, right? You get up, you shake it up. You ever had that instant where you kind of like, you get a little tumble, like, yeah, it kind of hurt, and then the next day you're kind of feeling okay? That happens all the time, right? Well, that little segment there actually came out of alignment and can rob up to 60% of the organ involved. So there's actually a study that was done back in the early 1900s where somebody took a bunch of cadavers because they were curious back then. Why is chiropractors helping people get healthy? Well, what they found was those regions that were causing issues in your heart, your lungs, a lot of those organs were severely degenerated. When that happens, it's actually going to start choking off the nerve long term if you don't do anything about it. So that area can get robbed up to 60% from that initial instant that you may not even feel. That's what we call a silent subluxation. Now, how soon after this little segment goes out of place do we think it'll start degenerating? Give me a ballpark time frame on how soon this is going to start degenerating. Throw something out, anybody.
Immediate.
Immediate?
3 months.
3 months?
5 days.
5 days? 2 weeks. 2 weeks it starts degenerating. And then it's just going to compound over the years and years and years that we don't do anything about it. But the amazing thing is once we correct it, it's going to stop that, and that's why it's actually preventable. So that's the unique and then what's really cool, and I see this all the time too, is that you can have somebody, say like 60 years old with a very healthy looking spine, and somebody who's 10 that's have degeneration already. It's all going to be when the event happened that brought on that subluxation, misalignment, nerve interference. So that's one of the other things too that can be very unique and involved. Now, as we talked about too, that 60% I was talking about, right? A lot of those organs that can be affected there. What happens to us if we have these regions of nerve interference and say an organ is dysfunctional? What's the term that we call that? That's a symptom, right? So as we can see on my purple poster here, some symptoms that we notice, say, from interference in the neck is tinnitus, so ringing in the ears, right? I've got a few patients that I'm working on just pure tinnitus right now. And we've had a lot of success. Say the mid-back, that thoracic region. Indigestion is another one cause too. We had somebody start the other day that's feeling a lot better. The last one, there's constipation. This one's kind of cool because it's actually, I've had people in their 60s that have improvement in constipation, and I had a 1-year-old that I got to see today, and she's doing fantastic with constipation that started. So it's just amazing. But that's another region, right? We're not in pain. Our body's telling us these symptoms that there's issues within our nervous system that we can work to help correct. So, as we talked about before, you mentioned pain, or we're probably going to feel that. Guess the percentage your overall nervous system actually perceives pain. Throw me out another number. 10%. 10% of your entire nervous system only perceives pain. Like 10%. That's amazing. So by the time we're actually feeling it, and you can see through my degenerative poster here, the first phase is just, say, like a lack of alignment as well, too. Like it's going to start going out. And then after that, it's really going to start showing signs. And so it can be months or even years that we have these areas that have been sitting there where you actually finally see and feel pain as well as notice those degenerative changes. Now, a great question is, what can cause a subluxation, misalignment, nerve interference? Throw me out something. What can cause your spine to go out of place? Fall. Sorry? Lifting. Car accident. Hey, stress, right? Oh, exactly. So, even pregnancy, especially lifting improperly, it's throwing too many hay bales, getting tossed off a horse, even food chemicals, allergens, you're sneezing too much, you can throw out a rib or two, and 100% stress, like the mental part as well, too. So my job as a chiropractor is to evaluate your entire spine and your nervous system and correct those regions of nerve interference or subluxations. When that happens, it's going to restore the motion, it's going to stop the degeneration, and at the same time, too, your body's going to do what it does best, heal itself. If you get a scab on your finger, right, who heals it? know, like you really love picking that scab. It's going to take so much longer to heal, right? And over time, that's what happens to ourselves. Is we have this tendency to like push back. I got to get the task done. I don't care how long it takes, and we got to get it done, right? But what can we do then to stop picking the scab? And this is what I do with a lot of my patients, because there's always a classic question. I had somebody who grilled me the other day. Like, well, if I start chiropractic care, it's just going to go out of alignment again. How do I help it? Well, it depends on how long it's been sitting there, right? So if I got a segment that's been sitting there for years, months, because you didn't notice it until we're really in pain, yeah, it's going to take a few adjustments to get that segment back to really hold that alignment. But how do you hold the alignment? Well, you got to make changes that are going to stop picking the scab over time, right? So for that, when we get into things, I like to break it down on 3 different, basically categories of what causes the picking of the scab or produces the threshold that's a misalignment in the first place. Those are going to be thoughts, like the stress from a stressful wife, traumas, such as car accident, lifting improperly, and then toxins, what we're exposed to, whether that's, cigarette smoke or just bad eating processed foods all the time. So, as homework for everybody else, I'm going to share some insight on how we can actually combat that. Number one thing I tell everybody that comes in and starts care with me is not only do you have to ice when you're feeling soreness, but you have to listen to your body, right? So the symptoms that we're experiencing, the pain that we notice, right? Those are our symptoms and messages from our body telling our brain that something dysfunctional. So we need to avoid that. So that's when we come into every 45 minutes, you want to take a break, you want to stop. So remember how we talked about, I got to get the vacuuming done, I got to get the lawn cut, I got to get this task done. That can be anywhere between like an hour to 3-hour job sometimes. But if you don't stop at 45 minutes, check in, listen to your body. What do I need? Do I need to stop? Do I need to sit down? Do I need water? Do I need to stretch? Or inversely, so you got a really long car ride, right? Even just something simple as switching your position in your chair so you're not chronically holding that position can help our bodies over time. So, that leads us in what we can do in the morning to actually help us get moving and grooving, because stretching and motion are so important for not only your spine, every single joint in your body gets nutrients through that movement. That's why we see when these areas of our spine are out of alignment, they can't move the way they should. That's why the degeneration is compounding, right? It's trying to stabilize the region, but it can't because it can't get the nutrients it needs. So in the mornings, I always recommend that. And my Nana actually practices it. She's a 92-year-old and still no walker, no cane, like just does these morning exercises and doing fantastic. Funny story about, we just recently moved her into a home. She came down for dinner and like the entire floor is lined up with these walkers. And she's like, oh, that'll never be me. And that's part of the reason of getting motion in the morning, right? So I want to share with you a really good one to start. Who here's ever heard of the cat-cow? And I don't mean the animals. So the cat-cow movement is a very simple movement where we go from what we call flexion into extension. So the flexion portion is going to be as your cat. In typical yoga, we're going to have our hands over our shoulders, knees over our hips. And what you're going to do is you're going to go through that flexion. You actually do this in a seated position too. So we're just basically bending forward. And then we're going to go all the way back. You can feel that motion throughout your entire spine. You can do about 3 to 5 of those in the morning. If you want to add a big breath, which each countdown, it actually helps wake everything up. Also going to calm your nervous system down a little bit too. So now that we've got that covered, although the caveat is if you are going through a cat-cow, you notice discomfort, pain, restriction, it is good to get screened. Your spine, you might have an area of nerve interference that needs to get addressed. But let's move into more of the strengthening the muscles to help improve posture and balance. So there's a few things I always recommend, 2 things in particular. So the reason why posture is so important in the neck, especially when we're looking at the cervical spine, is you can see this nice natural curve here, right? The reason we have curves is because this entire thing acts like a giant spring to help basically support ourselves and when we have gravity on it. What happens, for instance, if I take that spring and like everybody else is, I'm looking down on my phone. I see kids like this all the time, right? They're just constantly in their phone. Well, we're putting a lot of strain on this entire spine here. And what do you think is going to happen? Because who can guess how heavy your head actually is? You're close, actually. It's 10 pounds. So the weight of a bowling ball. So you can imagine, just as another instance, like you ever held a bowling ball to your, somebody's trying to go bowling, they hold it pretty close to them because it's easier to hold, right? But as soon as I get that further out, it's going to be a lot more strain. And in this case, we actually compound the amount. So, perfectly level, going to be 10 pounds. An inch forward, 20, 30, 40, 50. Somebody who's just like this, 60 pounds. Now over time, if somebody's like that, it's going to produce that extra threshold again. It's going to cause those segments to come out of alignment because they're trying to take all the weight. They're not moving the way they should, and they're being chronically held. So, we're avoiding that position to start. Now we got to strengthen the muscles in the back. So to do that exercise, what we're going to do is we're going to start with our palms out. We're going to open them up, and then we're going to squeeze our shoulder blades together. So now we're strengthening it between the shoulder blades and the back. Now we got to focus on neck position. So now we're going to go for what we call a chin tuck. It's okay if you got a double chin, we all do. And then now, if you want, we're just going to bend that neck back a little bit and hold there for 10 to 20 seconds. Do that up to 3 to 5 times a day. Very beneficial for overall posture and strengthening those muscles and helping. The next one, here's one of my favorites, because this one's always fun. And we're going to do an interactive exercise today. It's exactly like it sounds. It's the one-legged balance exercise. So this is so important, not only to get your brain-body connection improvement, but fall prevention. So for this one, what you're going to do, and we're all going to get up in a second here, but you want to find a support first, right? So that's going to be the chairs in front of you. It can be a table, it can be a wall. Do not use the person beside you, please. So with that being said, everybody stand up. Make sure you're either near your chair or around it if you need to. And what we're going to do is we're going to start, if you want to position your chairs in front of you, or you think you can handle it too. As long as you have the support nearby, I'm going to be counting down, and we're going to be doing both legs, because we want to find out where the imbalance is and how strong you actually are. Everybody ready? Okay. We're going to start with our right leg. If you do the left first, that's fine too. So we're going to lift up that left leg, balance on our right. We're going 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Great job, put it down. Now for the next one. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Great job, everybody. Now that's an excellent baseline. So if you needed to use 2 hands, the next phase is just using 1. If you're only using 1 hand, try to go to 1 finger and eventually get to no fingers. Depending on how old you are, any age, you should be able to do no fingers for 10 seconds. If you noticed you needed support today, that's something you can work on every single day. 10 seconds of your time, 20 total, to make sure that you're working on improving your balance. Why is this important? Because if we have better balance, it's going to decrease the amount of falls. The decreased amount of falls, depending on how old you are, is 1, preventing a hip fracture, and 2, preventing trauma to the spine that ends up in a misalignment that causes more degeneration, that cascades into even worse things for our health, including all of the symptoms on my purple board here. So now that we've covered traumas to the spine from a physical standpoint, everybody can sit down now too, I'm sorry. You did great. We're going to have a couple more exercises here in a second. So, when we break down the 3 T's that produce the threshold that is a misalignment in the spine, we just tackled traumas. The next one is thoughts. So, the stressful wife, for instance.
She's not, so it won't be to clear that.
I appreciate it.
Knock me off.
I'm sure he said light, not white.
Oh, exactly. So, overall stresses in life, right? That can be anywhere between something that's stressful, depressive, sad, anxiety, anything that's going on. So, there's 2 other recommendations I always give people to help conquer that. The one is a daily mindfulness exercise. So, does anybody here know what mindfulness is? By a show of hands? Kind of? Okay. So So mindfulness is being essentially present in your belongings and your surroundings. It's a very good exercise that you can use for roughly 10 seconds to a minute every day to help calm the mind. Because a lot of times we're thinking about what we need to do next, what you're going to have for dinner, what's going on tomorrow, what happened yesterday, this person, that person. Throw it all out for a minute. Just be present in the moment. That's why going out and being one with nature, going out for hikes, going to the lake, or just being mindful of where your surroundings are helps calm that mind. The next one here to help with, say you're not in a position where you can really calm your mind, right? You're kind of getting really stressed. You're kind of getting in that spiral, where you're like, I don't know, you're hyperventilating a little bit. You just stop. You're going to count down from 5. And at the end of that countdown, you're going to think of the happiest place in the world, or a thing, or whatever that is. You're going to think of that happy thought. Has anybody seen Happy Gilmore? Yeah. It's the happy place he goes to, right? So, and if you're really stressed, you got to take a big breath as you count down, calm yourself. So we're going to do this one together. So I'm going to count down, and at the end of the countdown, you're going to close your eyes and think of the happiest thought in the world. So, ready? 5, 4, 3, 2, 1, happy thought. Take a big breath in, all the way out. Open your eyes. How do we feel? You're still there. Always should take a bigger breath with each countdown, but a little less stress is the goal, too. So practicing mindfulness and 5, 4, 3, 2, 1 happy thought are a great combination if you find that your mental is affecting your physical. Last one on here is called toxins. So this one's a little bit interesting, a little bit harder to modify on a daily basis, but as we've all talked about, toxins can be chemicals that we expose ourselves to. It can be processed foods, can be things just overall like allergens too, or pathogens like colds and flus. Some of those are a little bit harder to combat, but has anybody ever heard of the term, you are what you eat? 100%, right? So this is anything that we put in our body's going to use. That's why it's so important to have a healthy diet, eating fresh food, supporting farmers markets, especially all the farmers that have come in today too, and avoiding exposure to toxins or eating processed foods or even frozen foods for that matter. So if you're already on the healthy mend, there's also another level. If we can't get those fresh foods that we typically know that we can't in the winter months, then what can we do? Well, supplementation can be beneficial, any means by that. But vitamin D is actually one of the most important because 90% of actually Canadians are deficient in vitamin D. Well, I'm laying out in the sun in December, I gotta be getting my vitamin D. You're not. Because of the position actually of the earth relative to the sun in the winter months from November to April, you can't actually get any vitamin D from the sun. That's why taking those supplements or making sure you're getting vitamin D heavy foods like spinach or salmon are very, very, very beneficial. But if you know that you're not getting those from your foods that you eat, supplementation is the way to go. And I'm going to give you a little caveat on vitamin D. Vitamin D is a fat-soluble vitamin. This means that the only way you can absorb it, if you're taking one of those tablets that you find at your local pharmacy, is that you have to have something in the tank as a source of fat for it to latch onto. It's the only way your body's going to be able to absorb that. So that's why I always actually recommend, and I use myself, is the liquid version of vitamin D. Because that way you can just put it underneath your tongue. You don't have to have any food in the system. If you're one of those people that just wake up, have a coffee, and go, then having that little bit of vitamin D, 1,000 to 2,000 IUs is perfect. Helps support your body, your nervous system, especially your immune system. And I always recommend upping that to around 5,000 to even 10,000 IUs during the cold and flu seasons. It's going to give your immune system a massive natural boost in combination with doing your exercise and everything else too that we talked about, right? So, with that being said, practicing these daily habits helps us minimize our thoughts, our traumas, and our toxins. But, as we talked about, life stressors are always going to happen, and eventually a threshold will produce the subluxation that results in the nerve interference. This is why it's so important to see a chiropractor on a regular basis to adjust that segment, restore its regular motion, and prevent potentially degeneration over time, too. For instance, though, even if we're paying free. Because, as we talked about, that segment there's robbing 60% of that output, producing probably some of these symptoms, if not they are, and 10% of that nervous system perceives pain. So if you are feeling pain, don't get me wrong, sometimes like you can, but even just going, I can tell you so many times I have somebody who comes in for the routine adjustment, they're feeling great, they're moving good, they come in, I'm palpating, doing my thing, feeling the spine, I find an area. Like, oh, I didn't know that hurt. Like, yeah, that's why you're in. We correct that, we keep you moving, keep you functioning the best you can overall. So that's why chiropractic is vital for helping your body heal itself from within, keeping your spine healthy, and that's why it's so important. If you haven't seen a chiropractor before, get in. If you have, excellent, and it's been a while, just make an appointment overall too. Just take care of your spines and your health, and make sure you share it with your kids and your family and everybody else too. It's the last thing we want to see, and we see this more so, and it's kind of sad, but all those walkers that I was mentioning with my 92-year-old Nana, right? A lot of that is just things that we could have prevented by seeing a chiropractor, getting adjusted, while doing more daily mindfulness, 5, 4, 3, 2, 1, happy thought, those postural exercises, and especially the one-legged balance. I've seen my Nana do it. She can do it for 10 seconds each side. It's fantastic. With all that being said, thank you for your time. I am open to any questions anybody may have. Go ahead.
How long, if something has been damaged for a number of years, how much time can you not fix it until it's unfixable?
It really depends on the spine and on the extent of the damage. So I want to refer to our degeneration poster at the front here. We have the 3 phases, right? So your phase 1 is out of alignment. Phase 2, we're seeing changes. And phase 3, we're fused together. If we're into that phase, what's happened is I've squeezed that nerve to a point where it's going to start affecting or atrophying. So that's going to be weakening of that area. If I see somebody who's in phase 2, we got some wiggle room and we can play around and we can stop that from getting to the complete fusion. So it's going to differ depending on what I see. If I'm in phase 2, usually around 3 months of conservative care with corrective exercises can get us back into the right direction. Does that answer your question?
Sort of. My son had an accident, and I took him to a chiropractor. They made him better the first time, worse the second time, better the third time, worse, better, and I quit.
So after an adjustment, you may feel better, the same, or worse because it can be a bit of a shock to the body. So for instance, remember all those falls that we had as a kid and we kept going up? Well, those are those regions in our spine that have been holding there for quite some time, right? So say we finally feel that pain, and then we put this back where it is, even though the body and the brain have recognized that as normal for years. It's going to be a bit of a shock. It actually takes 15 solid adjustments to make changes in your nervous system, and that's why, like, well, I tried it, didn't really work. Well, have you ever done like a dose of antibiotics for a bacterial infection? If you stop halfway through and don't follow through, are you actually going to cure the bacterial infection? Make it worse, right? So that's why it's a lot of times I see patients all the time too, and I wish I brought my other chart. Is sometimes we'll see slower results, but then it'll turn around as the nervous system starts making changes. And this is the other thing too, because the body is so unique and so adept that it's going to pick and choose whatever it needs to heal first. And then it's just going to check off the boxes as it goes through. Part of that is a team together. Like, I can lift somebody up to a certain extent. If you're not doing your homework, we may not be able to get to your goal. But at the same time, too, say we got somebody who's not moving regularly, eating like crap, and stressed out of their mind. Did we just hit all 3 T's? We did, right? So your body's in a very stressed inflammation state, and I'm trying to heal it naturally by allowing your brain to communicate. Well, you know, if say we're drinking way too much, then a lot of the blood flow goes to the liver, right? So we got to prioritize that. Say we get on repetitive falls and we're not exercising, well, we got to go to like healing the body there too. So when I have somebody that's in an acute flare-up state or in pain, I'll let them know right away. Your body's going to pick and choose. I couldn't tell you how many times I've had somebody come in with neck pain, That gets resolved. I have low back pain. That wasn't there before. Yes, it was. Your body was telling you that your neck was a priority, and now we got to focus on the low back. One of my favorite stories too is I had somebody come in, they were dealing with chronic knee pain. I didn't once touch their knee. I focused on the nerves that supply the knee, L3. After a course of care, month and a half, knee pain gone. And they're like, what happened? You didn't even touch the knee. I was like, that's because all those nerves in your low back, they supply that knee. And once I restored that motion, they could bring the brain's connection to the rest of the body, and it healed itself. That's the magic of chiropractic. This is why I live every day, because like it's amazing how many times I can have somebody come in, we start care, and they're like, I'm feeling way better. Like, how is this even possible? I got a really good, this is my favorite story to tell. I had somebody to come in, and they were dealing previously with shoulder pain, and they went through the medical system, and what ended up happening is they didn't focus on the neck, they just looked at the shoulder. Months later, and they were in their like late 20s, they had to have surgery to correct the disc herniation in their neck. They came to me later. I've got low back pain, I got referral into my leg. I do not want surgery again. So you got it. Month and a half later, low back pain gone. Another couple months later, headaches are gone. This is my favorite part of the story. We're on a maintenance level now. So she's coming in every once a month following all the recommendations that I just informed you of and more. And she tells me, I've been working with a psychiatrist and we've been working on my ADHD and we've noticed some changes. I was like, is that possible? I was like, 100%. Because if I'm clearing the entire nervous system of the rest of your body, like we talked about too, what's now the priority that is working to heal itself? The brain. It's just amazing how naturally your body can heal itself too. Like it's not going to be all one hour. I can't cure anything. I never tell anybody anything. I can cure it. I can get you out of pain really quick, but if you want to maintain that, that's going to be up to you. But it's phenomenal how much like influence your spine can have and your nervous system can have on the rest of your body. I got another good story too. I had somebody who was dealing with very high blood pressure. They were coming in to see me, they love natural means too. I focused then, and you can probably see it on the symptoms there too. Our main region that supply our heart is going to be in this region here. So I told them straight up, we're going to focus there. After a few visits, they came up to me, he's like, so my blood pressure's gone down to the point where I'm actually scared to take my blood pressure meds. I'm like, fantastic. I got another really good story too. Like I had somebody come in, they were going to go to Greece and Italy and have like amazing cuisine and everything else, but they couldn't swallow. Right? They were having issues with actually swallowing. I took an x-ray, found out phase 2, almost phase 3 of degeneration. Now you can imagine if I have those nerves there, how much that's going to start putting on there. We went through a month straight of like 3 times a week, 4 weeks solid. They could finally swallow solid food by the time they went overseas. Like, it's phenomenal how much your body can heal yourself. I'm talking a whole lot, telling a whole lot of stories. Does anybody else have another question? Because I can keep telling stories all day.
Is that the natural shape that our spine is in?
That is correct. Yeah. So you're in the low back and in the neck, you have what we call lordosis. So those are the natural C-shaped curves that we see. Your neck curve is actually developed from tummy time as a kid. So when you're on your stomach, you're starting to lift your neck up. That's what develops your natural curve. That's why tummy time is very important.
I don't think we had that when I was a kid. I think we went right from cradle to...
Gravity does its own thing. But when you're crawling, that's what happens to the low back. And that gravity develops that low back curvature. And then your mid-back here is actually called a kyphosis. And that just naturally developed within the womb. So that's your first curve, and then gravity takes its toll to get the other two. But what we can see over time, so remember how I was mentioning the phone and like looking down all the time, especially in kids, is that strain of the bowling ball is going to start bringing this into the kyphosis. And then that's essentially what their curve is. Now, if I have that, how much pressure do you think I'm putting on the spinal cord at the middle? Quite a bit. So that's where we can see a lot of headaches and issues with like overall like our spine and our nervous system as a result of just that prolonged phone time. And that's why we're seeing early degeneration, even more so, right? And essentially younger generations that are always on their phone. I tell my little sister all the time, like, hey, like, watch your posture. You can tell them enough times, you're just going to do their own thing until they're ready. Any other questions?
What's the difference when chiropractors use manual manipulation or they use that little
Activator. I should have brought mine with me. It's also known as like the clicker. So the difference is basically essentially you're doing the same thing. It's just a gentler approach. So it depends too on the spectrum. So a traditional activator technique is actually going to be stimulating the ligaments involved in order to stimulate the nervous system, right? So a lot of times you'll provide gentle pressure to these areas here. That's going to slowly bring it back. But sometimes it's going to typically take a little bit more depending on the body type. So that's why there's a variety of techniques versus manual. So like I'm going to be contacting one way or another. It's a high velocity, low amplitude thrust. So essentially I'm providing a little bit of force at a lot of speed, and that's going to correct that segment. That's why we typically notice that like cavitation or crack sound, because you're going past a certain level of the range, and that's what happens. You know, like when you crack your knuckles, it's the same premise. So they're both just as effective. I have some patients I do strictly activator on, typically anybody who's got osteoporosis. I have other patients I do strictly like manual because I love getting crunched and cracked. So I offer both, and they were still just as effective. I've seen multiple people get to where they want with their health and spine goals. Great question. I believe we had a few others over here. Take in the right hat and then I'll get you to see.
Is it better to use heat or cold?
After
you have an incident.
So after like an acute, so say I sprain my ankle or something like that, you're going to want to use cold for the first 3 days. So when you have an acute injury, there's a lot of blood flow that's already coming in there to kind of contain the region. If you put heat on it, it's going to put like gas on the fire, right? Like we're going to have an inflammation storm in there. That's why we want to cool it down as much as possible for the first 3 days. And then we're going to switch to heat at that point. So cold to start, then switching to heat later on. The caveat is though too, say we are dealing with an arthritic joint, it's going to love heat. So that's why it's typically like at the end of the day using that hot tub or a heating pad too on like those areas that we do have arthritis is okay. Typically when I start care with a lot of people, I always recommend ice because I think we talked about it before, you know, we might feel a little bit worse, so we want to calm down the inflammation and the changes that we're making to the spine. Yourself?
Yeah. I spend a lot of time looking back over my shoulder, driving a tractor.
Okay.
And it gets very sore. And it stays like that for days. Is there an exercise or something you can do to kind of ease that?
There's a combination of 3 things. One, we're going to need to correct that area that's causing soreness through the adjustment first. 2, you're going to have to switch it up every 45 minutes like we just talked about, right? So you're doing that movement for a long period of time. The reason why 45 minutes is so important is because after 45 minutes of a sustained position, your muscles are actually going to fatigue. When they fatigue, that can lead to injury, and that's why they're just like, all right, I'm giving up. You're either going to create a huge tight knot in that area, you're going to pull the segment out of place because it needs some sort of relief, and then potentially weaken over time. So what I recommend, and I've had people like that who are like, yeah, I have to continue looking over. I was in Saskatchewan for a couple of years, so I had combiners and everything else too. So usually if you can, positioning a mirror to help you, or any way possible, if you can turn your body a little bit more. But if it's chronically sore, it's going to be a combination of, you got to work the muscle nut that's been chronic for there, you got to adjust the spine and correct that segment so it can move the way it should, stop the degeneration, evaluate how much there is, and then just work on little things. Typically, you're going to, like a stretch, strengthen standpoint, you're going to want to work the opposite, right? So if I'm constantly, classic example, if I'm always using my one arm to like lift stuff, it's going to be really strong, right? So you got to like stretch it out the opposite way and then potentially strengthen the other side. Does that answer your question?
Yeah, it's sore all the time, like when you turn.
Yeah, it's that prolonged position that we've got, and like we talked about too. So there's going to be areas that are out of alignment, irritating the nerves, the muscles itself are tight, everything else in there needs to be basically corrected, and then over time it'll start healing and feeling better. That's when we can talk about using heat a little bit too in that area.
Sometimes it just tightens right up, really, really tight.
Yeah, like I had somebody this morning. They came in. They're like, yeah, it's like I can barely move my neck at all too. Like this position is really hard. I feel in there. I'm like, yep, really tighten up. But then what I noticed is this area here was just cranked towards that right side. So that's a pretty bad subluxation, misalignment, nerve interference. You know what happened though? This is the best. I corrected that today. Guess what happened to the muscles?
Yes.
Guess what happened to those muscles that were tight?
Relax.
Exactly. So that's that region localized. What happens too is, and this is another area as well, is when this segment comes out of alignment, there's a sympathetic response, and that's our flight and fight part of our nervous system, the local. So when this happens, it's actually going to create basically like all these tightness around our muscles are going to try and contain this area, as well as you're probably going to. I've had patients before that are like, yeah, I kind of get like a little jittery because like that's your sympathetic nervous system at play. You're trying to fight or run from the bear that's not there. So when I correct it, that actually helps restore a flow to our autonomic. So autonomic nervous system is essentially part of the sympathetic fight and flight, parasympathetic rest and digest. So I just cued in to our parasympathetic nervous system, body now rests and digests. The muscle starts to relax, starts functioning the way it should. That's why the adjustments in combination with the stretches and exercises and even massage are all encompassing to help with the soreness. That's a long-winded answer, I'm sorry.
I can see one of you fellows say this.
Yeah. Carol can help you after if you need. Sorry, ma'am, you had a question too?
Can you fix vertigo?
It just depends on the type of vertigo. So there's multiple different types of vertigo. So we can have benign proximal or BPPV. So that's typically involving the crystals that have been displaced. And that's usually, I've actually helped somebody with that too. You go through a specific maneuver to reset the crystals over time, or what we call cervicogenic vertigo. Now, do you remember what the neck is called? The cervical spine. So it's specifically coming from the neck in general. So it just depends on the level of vertigo, both of which I've called.
What's your thoughts on all the massage pillows and chairs and all that that they're...
The massage pillows and chairs?
Yeah.
Like in
Not-
malls or
Is that a
whatever?
good thing, or like those vibrating pillows?
There's levels in which it can be beneficial, depending. So, like, if we have very tight areas, sometimes working out those regions can be beneficial. You know, like I actually do start with typically using a handheld massager called the thumper. But sometimes it just depends on how our body reacts. Everybody's going to be different. So I've had people before where they go or they use one of those massagers. I've even experienced myself where it's too much, it causes a spasm, you know, things are out of place as a result now. So it really differs. Everybody's going to be different. So I'd say typically listen to your body again, try it out. If you find it works, good. If not, then you either have to find something else or kind of avoid it. So, okay. Anybody else? So we'll go.
Sciatica?
What about it?
Is it caused by misalignment of the lower back?
You can.
Because I had it earlier this year, out of the blue, never had it before. I presume it's when the pain goes down one leg.
Was it in the front or the back?
Back.
Yeah. So that's traditional. I hear it all the time too. Some people get sciatica and they notice it in the front of the leg. That can be a combination of a few different things. If it's in the back of the leg, we can see how a lot of these nerves here are going to come and form your sciatic nerve. If we have this area in the low back that's out of alignment, or even a disc bulge here too, it's going to irritate those nerves and cause that numbness, tingling that we notice in the foot. A lot of times, don't have my dermatomes here. So there's certain regions of your entire body that actually supply these areas, right? So if we notice traditional sciatica going through the back, it can be a combination of not only a misalignment or nerve interference in the sacrum itself, but also very tight muscles in there. That's why it's the combination. I usually give somebody a stretch and exercise to help with the holding the adjustments too. If we notice in the front, so say I got numbness and tingling in my foot, on the top or the side or the back, that's going to be, I'm just giving it a generic like for everybody. That's going to be coming from more of these nerves in the low back. and that's just going to be distributed. Once again, once we correct that area, it can move the way it should. It's going to help heal itself through all. Fun fact for everybody, depending on how old you are, almost a lot of people, like basically from 50s on, are going to have this bulge and herniations in their back. It's just through a degenerative process of time because of gravity's essentially tolling the body. But like 90% of those are asymptomatic, meaning they don't present any symptoms or signs. So say if I took this entire, everybody here, and got you all MRIs, we're going to see disc bulges. But only compounding with like an orthopedic exam and consultation is you're going to see whether or not that disc bulge is actually irritating the nerve, causing what people sometimes call sciatica. Long-winded answer again, I'm sorry. But yes, 100% I can help with that. Sir, you had.
Yeah. I've had sciatica issues for years, and then after I had my hips replaced in 22 and 23, 6 months apart, my sciatica came back with a vengeance. So the surgeon and my family doctors have never suggested chiropractors, and it was always physiotherapy. So my surgeon recommended in his clinic, his office there, and he has a chiropractor, physiotherapist, a kinesiologist, acupuncture, and you name it, it's in his clinic. But it was physiotherapy, so I had a physiotherapist and a kinesiologist. But my family doctor has never recommended a chiropractor.
Yep.
Always a physiotherapist.
Do you want to know?
I'm fine.
Do you want to know why? Is that your
Yes.
question? Okay. Yeah. I kind of figured that was the question.
You read my mind.
Yeah. In the spectrum of healthcare, I've seen myself, it's usually around anywhere between 20% of medical doctors that will refer to chiropractors. And I want to give everybody a little history lesson because we're going to go back to the 1970s and 60s where there was a bit of a butting heads. And there wasn't really, because it wasn't about helping people for them. It was about the money that we were taking. Healing people naturally, as I've just described in my entire presentation. Well, what ended up happening is the AMA, or the American Medical Association, started boycotting chiropractors. That's the whole quack term that probably people have heard in the past too. So they developed for instance, if I wanted to join a golf club and a medical doctor was on the board, I'm not getting in. And in fact, they would tell, oh no, don't see that quack, because they thought we were taking money from them. What ended up happening, it's now illegal actually not to refer to a chiropractor, especially in the States, is that some of the medical doctors, and this is why I mentioned 20%, this is wrong. We should be helping people together. They leaked the entire legal document of the AMA to the lawyers of the chiropractors that were fighting this, and say that this is what we're doing and why. And I've learned in school too, like there's levels of which like medical doctors still have that stigma today, and they refuse to look at the literature within the study world that actually proves how effective we are at not only low back pain, but even like ear infections in kids. Because I can't give you a good reason of why. Like I'm more than happy if I get somebody who I can't help, I'm referring them out. I did that a couple weeks ago. You know, it's like the medical system is there, but for like wellness and quality of life and everything else too, that's where I come into play. It just depends, right? So unfortunately, sometimes we butt heads. I don't intend to do that, but a lot of times if you look at the baseline where a lot of things are coming from, it's going to be money, unfortunately.
And my second question is chiropractor covered by OPM?
Ah!
Yeah, so people like me, a retired teacher, we have a pension and it is covered. But people who do not have that kind of pension from their work or others.
So we used to be covered by OHIP. We are not now. There's a bit of an issue. To be honest, they weren't really giving you much anyways. And that's one of the other issues as well too, and I can understand. That's why for me, and Carol knows this as well, we're very fair with everybody. I try to give you the best care possible within like financial means too, because I know like, especially now, times are tough, I get it. but unfortunately we're not covered. If you do have personal insurance, that's fantastic. If you got business insurance, it's fantastic overall. But usually if you let me know, I just want to help you. So whatever works as a team together. Like we had somebody the other day, it was just like, yeah, like money's tight. I'm like, okay, like what can you do? And like we just kind of work around that, right? So that's why I really despise the fact that like in our healthcare system, a lot of times, and here we're fortunate in Canada for the most part, but like I went to school in the States, right? Some people down there have to choose between, and even up here have to choose between their finances and their healthcare that